Okay, it is 11 o'clock now. Welcome, everyone. Thank you for joining us today. My name is Jennifer Tobin, and I serve as the Assistant Director of the Natural Hazards Center at the University of Colorado Boulder. I am so happy to welcome you to the Making Mitigation Work webinar series, which is hosted by the Natural Hazards Center and made possible with support of the Federal Emergency Management Agency and the National Science Foundation. This webinar series, which was launched in 2019, highlights recent progress in mitigation policy, practice, and research. A few announcements before we begin today's presentation. This forum is being recorded. The captioned video recording and presentation slides from today's webinar will be posted online at the Natural Hazards Center website at hazards.colorado.edu. This is also where you can find the recordings and supplemental materials from the prior Making Mitigation Work webinars, as well as gain access to many other free resources. In a few moments, I will turn the controls over to our speakers, but if at any point during the presentation you have a question or comment, please do submit those using the chat function or the Q&A box. I will monitor the questions in both places and return to them during the QA portion of the webinar. And thanks to a partnership with the International Association of Emergency Managers, attending this webinar does make you eligible to receive 1 contact hour of emergency management training through IAEM. But in order to receive the credit, you are required to attend the entire webinar session today. If you fulfill this requirement, you can then please email Katie Murphy at hazctr@colorado.edu to request your certificate. You can also visit the Making Mitigation Work webpage under the Trainings tab at hazards.colorado.edu for more information. Now I'm excited to introduce today's webinar, which is titled Climate Change Impacts on Children's Health and Well-Being. We'll be hearing from 2 U.S. Environmental Protection Agency scientists, Dr. Caitlin Gould and Lauren Gentili, as they discuss the findings of the recently released report, Climate Change Impacts on Children's Health and Well-Being in the United States. This report analyzes the effects of climate change on children's health. The report considered 5 climate change-related stressors: heat, air quality, changes in seasonality, infectious disease, and flooding, to help us better understand how each stressor might impact children under different levels of warming. The report also delves further into an analysis of how certain groups of children may be disproportionately affected by a particular stressor and health outcome. The speakers today will discuss how findings from this report can be applied to develop effective and equitable strategies for protecting current and future generations of children. So please join me in welcoming Caitlin Gould and Lauren Gentili to today's Making Mitigation Work webinar. Dr. Gould is an environmental health scientist with the U.S. Environmental Protection Agency, Climate Science and Impacts Branch. She has a background in mixed methods research, occupational health, and marine biology, and her Doctor of Public Health is in environmental and health engineering. Lauren Gentili is a geographer and environmental social scientist with the U.S. Environmental Protection Agency, Office of Air and Radiation in the Climate Change Division. She is also a co-manager of EPA's climate change website and leads climate change adaptation for OAR. And now I'm excited to turn it over to Caitlin to begin this conversation. But as a reminder to the audience, please do drop your questions in the chat or Q&A during Caitlin and Lauren's presentations, and we'll get those answered at the end. Caitlin, feel free to go ahead and start. I'll stop sharing my slides so you can start sharing yours.
All right, thank you very much for having us. Thank you all to you for joining in. Give me just a second. Get the slides up. And come on, there we go.
Okay, yeah, I think you froze for a second.
All right, I'm back. Sorry about that.
Caitlin, would you like me to share?
Yeah, that would be great. If you wouldn't mind, please.
Yep.
Thanks.
One moment. Okay, is this in presentation?
No, it's in notes.
Fantastic, here we go.
There we go. All right, awesome. Hi everybody. It's nice to see you. Thank you very much for having us today. Like Jennifer said, my name is Caitlin Gould. I'm joined by my colleague and friend Lauren Gentili. We are in the Climate Science and Impacts branch at the US EPA in Washington, D.C. Well, I'm in Washington. Lauren is actually very lucky for Lauren in Cape Cod. So, or on Cape Cod, down Cape Cod, depending on where you're from in the United States and how you what article you assign to it or excuse me, article. Anyway, I'm going off on a tangent. Next slide, please. On that note, so we're going to talk to you today about a report that we had that came out at the end of April on climate change impacts on children's health and that are projected out through the end of the century. But I first want to give you a little bit of background and information about our webinar, but also about the about what our branch does and sort of what this report covers. So I'll talk through that information, and then I'll talk about some of our results, not all, and then I'll turn it over to Lauren to talk more about our results, gaps that we identified in other areas. So I also want to mention it's lunchtime for us. It's actually after lunchtime. It's almost lunchtime for y'all. So we are happy to take questions, recognizing that's usually a good kind of format for this type of thing. We'll take them in the chat, and then we'll have about 15 minutes at the end of this for your questions. If there's anything that we can't address, that we'd be happy to talk about. So our branch is EPA's Climate Science and Impacts branch, CSIB. We'll talk about CSIB a few times today, probably, and we'll also talk about this acronym that you see here, CIRA, or the Climate Change Impacts and Risk Analysis Framework. So CSIB, we have a few main projects. We ultimately are climate scientists looking at a variety of different areas in which climate change is affecting our country and our world. So we have we developed climate change indicators that show climate change is occurring in different ways based on impacts on a variety of sectors, including cherry blossoms when they bloom, changing allergen patterns, changes in Lyme disease cases historically, things like that. We also work on CIRA, this acronym that I have up here, and that's what really forms the backbone for the project and this report that we're talking about with you today. So CIRA fundamentally is a framework for projecting, quantifying, and monetizing climate change impacts on a variety of sectors across the United States, including how risks can be reduced and addressed through greenhouse gas mitigation and adaptation. So what that means is, how is climate change happening, and what in the future could occur, looking at different levels of greenhouse gas emissions that are released, and based on how greenhouse gases are, the release emissions of greenhouse gases are addressed under different scenarios. So CIRA uses a common modeling framework. All of our reports, and these include these 3 reports you can see at the bottom, plus the one I'll be talking about with you today, as well as journal articles. I'll use kind of a common modeling framework with consistent inputs and assumptions, and also are supported by rich background, both in the literature as well as peer-reviewed literature, as well as publicly available data, or just generally available data. So again, we were really excited to add this suite, or this report, to our suite of reports. And if you could go to the next slide, I'll talk a little bit more about why. Next slide, please. Thanks. Why we wanted to focus on children's health specifically. So Lauren and I will talk a little bit today about how children are uniquely vulnerable to climate change impacts. I know a lot of you come from different backgrounds. So for some of you, many of you, all of you, this might be old hat, but children for a number of reasons related to their physiological, emotional, psychosocial, psychological development are uniquely vulnerable to climate change impacts. They're growing. I don't need to tell you all that. Kids grow. If that's a surprise, then we should talk about the childhood that you had. But children are just inherently vulnerable because their bodies are growing really fast, their brains are growing really fast, and growing emotionally and psychologically. So that was what really started us out wanting to work on this report. And we had talked with our colleagues in another part of EPA, the Office of Children's Health Protection, kept saying, gosh, we'd really like to collaborate on a product like this. Exactly for these reasons. Kids don't have the same kind of control as adults over their environment and their environs, the scenarios that they're in. Kids experience things more acutely. So, and in many cases, depending upon what the stressor is, kids have the potential to live with negative outcomes for a lot longer and negative health effects for a lot longer than adults do. So we started working on this. Certainly was motivated by the Biden administration and the fact that the Biden administration has very much prioritized children's health, climate change, public health for the entirety of its administration. We also, one of the reports that was just in a thumbnail on the last slide, we had come out at the end of 2021, September 2021. That was a report that was looking at social vulnerability and how different demographics, different types of social vulnerability, categories of social vulnerability were potentially, or adversely, affected by different climate change stressors. And so one of the pieces of feedback that we heard consistently was, well, this report's great and it's really interesting, but what about kids? You talk about kids, but kids really need this kind of focus. And that speaks to the fact that this is basically the only national scale multi-sector report that we could find or that we're aware of that focused on quantifying different types of climate change risks to children in the United States. So next slide, please. Oh, I also actually, before I start talking about this slide, I do also want to mention, I'm sure many of you are at CU Boulder. And depending upon what you do professionally, you're probably aware of the 5th National Climate Assessment that just came out. Mary Hayden's actually at CU Anschutz, and she was the lead chapter author on the National Climate Assessment's health chapter, which included a fairly robust discussion given the length that chapter authors were given for writing content for each chapter of children's health and potential impacts on kids and what we're already seeing. So that really speaks to just how important this issue truly is. So over the next several slides, I'll talk about some of the stressors, some of the climate stressors that we covered, as well as some of the detailed analyses that we did and emerging areas that were less detailed analyses, but still nonetheless significant. And so I just want to also mention this report is not exhaustive. We only talk about 5 types of climate change stressors. We talk about extreme heat, air quality, changing seasons, flooding, and infectious disease. And then we created detailed analyses looking more specifically at how extreme heat leads to learning losses or air quality leads to changes in asthma, emergency department visits, things like that. And then, like I said, we have these areas that we weren't able to do a full quantitative analysis on, but we thought would be really important to highlight. And so that's what these emerging areas are. To give you some context about this report, we consider kids to be between the ages of 0 to 17. However, you can see here in the far left column, wildfire, smoke, and fetal health, we do actually take fetuses into account where relevant at a few points in this report. I also want to mention we have pretty comprehensive literature reviews that kick off each chapter of this report, but of course they're not completely comprehensive. So they cover a lot, but they're not going to cover everything. And likewise with these analyses, these were things that we thought were really significant and interesting, and also that we felt needed to be explored, but they're not representative of all of the potential effects that could occur from children's exposures to one, some, or all of these climate stressors and others that we don't cover in this report. I do also want to mention we look at, and Lauren will talk more about this, but we look at children who we deemed as socially vulnerable, so children who don't have health insurance. And this is not true with all of our analyses, but where possible, We look at children without health insurance, children who are BIPOC, so Black, Indigenous peoples, people of color. We look at children who are low income and also who come from families that are have limited English or limited English speaking. So next slide, please. So I'm going to talk about some of, like I said, some of the methods, some of our results that we found. And please, Lauren, if you wouldn't mind, if you could put into the chat the link, or I can put into the chat. Please feel free to check out the report. The full report is available for download online, along with, thanks, Lauren, along with summaries, appendices, data. Some of the summaries have also are available for physicians, clinicians, and also parents and other types of caregivers. So written at different levels of I guess, medical background or health background and scientific understanding. We also have the summary for the public, I guess, translated into Spanish. So I'm going to talk through some of the results and what we learned about heat and learning and Lyme disease, and then Lauren will talk about coastal flooding. So I want to just, oh, thanks, Lauren. It was also for clinicians and the executive summary. Thank you very much. So before I go into some of our results, you can see over here on the right, this really nice, lovely conceptual diagram. Many conceptual diagrams are very lovely. This one's nice and succinct. So, but this is outlining our stepwise analytical approach that we took for each of the analyses, each of the quantitative analyses that we conducted. So we established current vulnerabilities among children, and then projected future environmental conditions dependent upon the stressor that we were interested in and that we were focusing on, and then forecasted future impacts on children linked with climate change. And so this is following a general framework, like I said, that follows our Sierra framework. It's an impacts by degree approach. So how do changes in heat and learning or Lyme disease incidents, things like that, how do those change with each change in degree of temperature under climate change? So we'll present, you can see a wider range of temperatures and effects in the report and in the technical summary that we have on our website. But for the sake of general understanding and consistency, we'll be talking about impact results based on 2 degrees and 4 degrees centigrade of increases in global average temperature. Next slide, please. So this slide shows, again, just some of the results that that we had under this report. You can see here this map is showing an estimated distribution of annual lost future income per per student at just 2 degrees centigrade of warming per year. So this is showing a distribution of lost future income attributable specifically to learning losses due to heat exposure during school years. And you can see areas with darker shading, such as up in New England, the northern latitudes have higher rates of learning losses, and the 5 states with the highest rates of learning losses per child are highlighted. So again, more areas that typically are, sorry, the little pop-up boxes where the chat's distracting. So typically are, these are areas that typically are cooler, where people may not be as acclimated to warmer temperatures as we are, for example, down here in DC, where Lauren and I live. But also areas that may not historically have higher levels of penetration of air conditioning. And so that really factored into our analysis, where we determined what existing learning levels were based on a standardized metric, and then determined rates and rates of school air conditioning and home air conditioning levels based on, and you can see in italics, papers that we based our analyses on, so Park et al. We then calculated future average daily maximum temperatures during the school year and quantified and valued future learning losses established by this other paper by Chetty et al. That we referenced down here at the bottom. So next slide, please. where we really get into a little bit more of kind of what we saw and what this means. So I want to take a step back. I said I was going to talk about how different stressors can affect children's health, and I am trying to be cognizant of the time. So I'm also happy to answer more questions about that in the chat. But effectively, in terms of heat and learning, heat can impact children's ability to learn in a variety of ways. First of all, anyone who's ever sat in a hot classroom or hot anywhere and has tried to retain information knows how incredibly difficult that is. And so that's certainly one area in which we anticipate heat affecting kids, but also it affects mood, it affects your ability to concentrate, it affects levels of aggression, it affects kids just wanting to sit still. You know, kids aren't going to want to sit in a hot classroom or a hot house. And that's another really important thing that that we saw, that we looked at with this analysis, because, you know, sleep, being able to do your homework and study is just as important to have basically a comfortable climate within your home as you know, when you're in school. And so you can see here in this table, like I said, we show 2 and 4 degrees of warming, looking at annual lost future income per child per year. So you can see it's about 1,300 kids at a lower level of warming of 2 degrees centigrade, which if you've read the news, you'd know we're close to. So this is a not very distant future, potentially, where school age kids between the ages of 5 and 17 could be losing, you know, could look to lose, you know, approximately $1,300 a year per child after exposure to heat. And you can see that this actually in aggregate is about $6.9 billion. So it's a pretty substantial impact. And given the nature of this webinar, given that it's focused on mitigation, I also want to mention that that we looked at adaptation efforts, and the estimated annualized cost of installing and maintaining HVAC systems is about $4.2 billion. So that's just in schools. It's about $4.2 billion. So significantly less than learning losses. However, we also found that air conditioning in schools does not mitigate the potential for learning losses entirely, and that one of the papers that we based our analysis on, Park et al., showed that learning losses are only really erased when air conditioning is equally available in homes and schools. Next slide, please. And I saw there was a question in the chat about Lyme disease. I will get to that in the chat, and I can also hopefully try to address that here. But in terms of Lyme disease, kids are outside and kids play a lot outside, hopefully. Yeah, kids, you know, kids are going to be, because they're outside more than adults, are going to be more likely to be, at least in some instances, exposed to Lyme disease. And in the United States, most Lyme disease cases occur in the East Coast or along the East. The paper that this analysis is based off of is actually still in review, hopefully getting published soon. Come on, EcoHealth. But I was looking only specifically at 22 states out east, and that's because of climatic factors, but also because of where tick habitat really is and where Lyme disease cases really are being shown. So what sets kids apart with Lyme disease versus adults is that kids can develop juvenile diabetes that can have lifelong effects. Kids can also develop cardiac issues, heart issues, you know, a range of other issues. And juvenile diabetes really, or excuse me, not juvenile diabetes, excuse me, arthritis. Sorry, juvenile arthritis. Fun fact, is actually really where Lyme disease was kind of isolated in the 70s in Lyme, Connecticut. It was based on a cluster of kids who were developing arthritis, juvenile arthritis. And so it's actually very interesting, but this can have lifelong effects. It's really significant. Just, you know, yeah, it's really significant. So you can see here, just like at on the last set of analyses that I talked about, or results that I talked about, at a lower level of warming that our country is close to, you can see here, these are the 5 states that are likely to see the greatest rates of change in new Lyme disease diagnoses. And so again, they are all in the far northern latitudes of the country. And I'm happy to talk more about that in the chat, just looking at the time again. But this basically was based on changes in tick habitat, temperature, precipitation, and land cover, as well as potentially impacts on, impacts on tick distribution, which also impacts, it is also impacted by predator-prey relationships between ticks and their hosts, which we did not factor into this analysis. Next slide, please. And so again, just to talk through these analyses really quickly, we were estimating that we could see potentially an estimated 2,600 new cases annually of Lyme disease just in kids. This is about a 4% increase it's a 1% increase. No, it is a 4% increase. I'm sorry. And then at 4 degrees centigrade, this actually increases to about 11% increase in number of Lyme disease cases annually in kids. Next slide, please. And so just to kind of drive this point a little more home about where things are, things are really changing. You can see the nice pretty cerulean dot over on the left is and this higher amount on the right with the lavender dot kind of showing our range and our standard deviation of cases. You can see that at baseline or in the Northeast, you can see that in the Northeast, we're estimating approximately, just based on that region alone, we're estimating approximately a 1% to about 170% increase in cases in kids. The Midwest, that could go as high as almost 800% increase. And then you can see here, and I misspoke, so I'm sorry. It was about a 20% increase at a lower degree of warming, level of warming, up to almost 300% increase in Lyme disease cases in kids. And so with that, I'm going to turn this over to Lauren to finish her presentation. And I'd be happy to take questions in the chat as well.
Thank you, Caitlin. And we can go to the next slide, please. All right, so switching gears a little bit on the different impacts to children, we also wanted to share with you impacts from coastal flooding. So this particular analysis.
Really quick, you're just a little bit muffled, quiet. You're kind of quiet. So if you sit closer to your speaker, that'd be amazing.
Okay, let's try that again. Any better?
A little bit.
Got my headphones in. Is it still too soft?
That's a little bit better.
Okay. We'll just jump in if for some reason it fades out on you. Okay, so this particular analysis looks at the impacts from coastal flooding risks to children, and specifically looking at impacts on their homes itself from either storm surge or sea level rise inundation. And I do want to take a moment and just mention that while we don't quantify these additional impacts, children are susceptible to a number of other things. That includes safety and health risks during flooding events, anything from drowning to mental stress due to displacement from their homes and communities, loss of schooling opportunities, and increased exposure to waterborne pathogens and mold and flooded structures. So this particular analysis, again, is only looking at the impacts to their homes. However, there's obviously a wide variety of effects on children not accounted for here. So for this analysis, we leverage what we call the National Coastal Property Model, and that's to model the number of children likely to be temporarily displaced from or lose their home from coastal flooding. So we really are looking at two outcomes. And the National Coastal Property Model does explicitly look at a with adaptation scenario, as we call it, and a no additional adaptive actions scenario. With adaptation is those protective measures you would expect to see, like building levees, seawalls, beach nourishment, elevating properties, etc. And the no additional adaptive actions are assuming properties are maintaining their current level of protection, whatever that might be. Our report gets into far greater detail, and you can compare and contrast the results of both of those scenarios, but for the purposes of this presentation, we're going to focus on the worst case, which is a no adaptive actions scenario and set of results. And while adaptation does reduce risk, gotta put the caveat that that is assuming well-timed actions, which is incredibly challenging. It also requires significant capital upfront, as well as maintenance costs. So when we present our results of no additional adaptive actions and are with adaptation, they really are meant to serve as bounding scenarios where that reduction of risk will fall somewhere between the two. Now, if you look at this graph here, or infographic, I should say, as Caitlin mentioned, we have the same sort of overarching three-step approach that we follow. And then in terms of some results here, this is showing the projected impacts to children's homes from that storm surge and sea level rise. And it's assuming no additional adaptive actions, and populations of children will increase over the 21st century. Now, looking at the far right, you can see the temporary home displacement outcome that I mentioned, and that's associated with a high likelihood of being temporarily displaced. That would be something like relocation as minor flooding subsides or repairs are done. And it's triggered by damages to residences, usually from storm surge, which we know is amplified by sea level rise. You can also see that it does affect significantly more children annually, over 1 million in both levels of sea level rise. And then on the left is the total home loss, which that considers the likelihood of that permanent home loss, which is the indicator of the most severe coastal flooding. Unfortunately, it's the most catastrophic. It is triggered by intense and repeated storm surge, but also potentially permanent inundation from sea level rise. So it's a bit of both. And looking at the table, while you can see that at 50 centimeters, it affects an additional 185,000 children. What's pretty interesting is actually it increases quite substantially to over 1 million in terms of children affected at over 100 centimeters of sea level rise. Next slide, please. All right, so this is to give you an idea of where in the United States we're talking about in terms of these coastal flooding impacts. This map shows the projected distribution of children affected by, in this case, home loss, or worst case, if you will, at 100 centimeters, and again, assuming that no additional adaptive actions. And then areas with the darker shading is showing the states with the highest rates of affected children. So you can see that it's concentrated within the Gulf and Atlantic coasts. Again, not surprising. When we dove into these results more, we could see that within the eastern US, storm surge is the major driver of home loss, which we would expect hurricanes primarily. Whereas in the Pacific coast, parts of California, it was actually sea level rise only that were affecting the homes, and it's where storm surge is also less severe. Next slide, please. And as Caitlin mentioned, throughout our report, we do try to look at the disproportionate impacts of these different stressors on overburdened populations of children. In this particular case, we're looking at, again, those 4 different demographic groups listed on the far left. And that you can see that children from all 4 of these demographic groups are more likely to be disproportionately experiencing temporary displacement from their homes at 50 centimeters of sea level rise. So that's the upper left bar graph. And then they experience total home loss, all 4 categories, of their homes at 100 centimeters of sea level rise, so the bottom right. Now, this may be reflective of the fact that the same child's home may be temporarily damaged at 50 centimeters, but then again, looking at the home loss part, that's more severe and likely to occur at that 100 centimeters. Now, one thing I do want to mention and worth keeping in mind is that with each interval of sea level rise that is being modeled, that band of coastline impacted by flooding is changing. And so the populations being exposed within those coastal areas also changes. It's important to also emphasize on this, because I'm sure you're already zeroing in on it, that negative values do not mean that the populations are not being affected by coastal flooding. All it's saying is that they are not more likely to experience the greatest impacts relative to the other population. Next slide, please. And then we also wanted to just sort of wrap up our presentation for you by discussing some of the key research gaps. We have far more that we've identified within the report, so if you are interested, we do encourage you to look at our conclusion chapter That not only includes the key research gaps, but a whole suite of actions and things that individuals and communities can take to improve the effects on children or mitigate or reduce the amount of effects on children due to climate change. So a couple of examples of our research gaps. The first is a big one. Our data limitations are confined, our analyses, to the contiguous US. So obviously Alaska, Hawaii, the US territories, Puerto Rico, etc. They are not accounted for in these analyses, and yet many of them are on the forefront of climate change impacts that are occurring. And so in the future, we really would like to be able to better capture those groups as well as those regions and the effects that are occurring and are anticipated to continue to occur. Another limitation is the data on how climate change would cause or exacerbate developmental and mental health effects in children. This obviously is a really key and emerging area, but one, again, due to data limitations, we haven't been able to really focus on. We do try our best to discuss it from a qualitative perspective, but actual data that we could analyze and quantify would be fantastic. We also would like to improve the forecasting of our adaptation measures, costs and benefits, and long-term effectiveness. Obviously, adaptation is extremely difficult to project. However, it is very important in terms of understanding what climate change impacts would look like, because of course, human behavior is a prime factor in how things will occur. And then lastly, expanding our studies, focusing on compounding effects, both at the national scale and then also looking at different demographics would be wonderful as well. Next slide, please. And then I know it was in the chat, but also here, Caitlin mentioned it previously. We do have the report itself, which you can access on our website. We have summaries for specifically clinicians and parents. We also have the executive summary, and those three are all translated into Spanish in hopes of being able to reach a variety of audiences. And then also we have appendices and data. So every one of our detailed analyses, our chapters, if you will, has an associated appendix that you can dive into the underlying studies and additional literature and results. And you can also access our data for each of the analyses that we did. Next slide, please. And that's what we have. We really appreciate your listening to us today. We're happy to take any questions you might have. Also, feel free to reach out to us. Our emails are here. We can also correspond via email. Thank you all.
Thank you so much, Lauren, and thank you, Caitlin. Katie, if you want to go ahead and stop sharing the slides, we can just get all of our images on the screen for anybody who wants to come on camera and ask a question. Let me change my little screen here. Okay. I think you did answer the one question that came in the chat already. But do you want to actually go ahead and read that out loud, Caitlin, and answer it just in case anybody missed that?
Sure, happy to. So the question was about mitigation of Lyme disease in kids and the vulnerability among children at risk for Lyme and mitigation strategies. So I can answer this one and answer this in reverse. In terms of mitigation strategies, there are, it kind of depends. You know, of course, bug spray, getting your kid to, or your child, your friends' kids, nieces and nephews, etc., to wear bug spray. That's kind of a go-to, although of course there are concerns and considerations with chemical exposures. So other measures can include helping kids to recognize ticks, and tick bites, know what the symptoms are of Lyme disease. If you're not familiar with it, Lyme disease has a very distinctive bullseye rash, but that doesn't always happen. And a lot of the symptoms of Lyme actually mirror symptoms of the flu or a bad cold. And so it's really important to kind of understand if your kids, outside playing a lot, understand what Lyme disease can look like literally and figuratively. Other measures include helping kids to dress appropriately. So wearing high socks, long pants, tucking their long pants into their high socks. And also working with parents, caregivers, healthcare providers to likewise recognize the symptoms of Lyme and to test and treat appropriately when possible. In terms of parts of the country, Lyme just is not common. In fact, in a lot of the country, Lyme is not common. So, it very much goes reported, underdiagnosed. Also, kids don't always show significant symptoms. So that's another reason, or parents don't know that their kid might have Lyme disease, so they don't think to bring their child to the doctor. Other reasons why Lyme disease may be underdiagnosed. There are a lot of reasons. There's actually a couple really interesting papers that are out there on it. In terms of vulnerabilities, so I talked about this a little bit earlier, how kids are just outside more. It's not that kids are developing Lyme disease more, it's that they're out there, they're more likely to be exposed to it because they're outside more, they're playing around more. So that's the thing. But also, like I said, there are some types of health effects that kids may experience that could really, that really affect them more than affect adults. And one thing we don't look at in this analysis is long-term Lyme. So it's PTLDS, it's post-treatment Lyme disease syndrome is the clinical term. And we don't incorporate that into our analysis. That's basically Lyme where symptoms last longer than a certain amount of time. And but that is, with kids, they have the potential to live with Lyme and health effects of Lyme disease for a lot longer, like I said, than adults. And one thing that we do with this analysis, anyway, I'm going off on a tangent. I could talk a lot about that paper. Lori, I see you have a couple questions in the chat if you'd like to unmute yourself.
Sure. Thank you. Oh, and I don't know. There we go. I didn't know why my camera wasn't coming on high. So thank you, Caitlin and Lauren, so much for this presentation. Was just incredible, and really knowing that this is the first comprehensive analysis of this sort. It is just so important. So thank you for doing this work and sharing it with us. So I did indeed have a couple of questions. So one was related to data, because as you noted, there were just various data gaps and data limitations, even given the comprehensiveness of this work. And so I was just curious if there are any efforts underway being led by the EPA or any cross-agency collaborations to try to start filling those data gaps to ensure that we do have data on the US territories and outside of the contiguous US, for example, and that we're really covering children in all their diversity. So yeah, I'd just love to hear about what's being done to fill those data gaps, if anything, to begin. Thank you.
So I can start, and then Caitlin, please jump in. So we outlined a whole lot of the limitations and data gaps, in part because we want to shed light on the fact that our report, while really great and covers quite a bit, it doesn't cover everything, not by a long shot. And so we had to really enhance a lot of the specific quantified analyses by providing, those emerging area discussions and more of a qualitative acknowledgement of the many different impacts to give that bigger picture. But for example, like the Hawaii and Alaska one, we've had discussions within EPA with our Office of Research and Development and Office of Air Quality Planning and Standards. We've also had discussions with the University of Alaska Fairbanks as well to see where we might be able to partner and or enhance. There are just within the climate models serious, just fundamental data limitations that go far beyond anything EPA does. It's literally part of the climate models that are produced. And I think what the best way to put it is by continuing to shed light on the fact that we don't have that data, but it's really, really important. It might be able to kind of get some momentum going to and willingness to invest in building out those data areas. Some of the other ones, like compounding effects, I think I saw somebody's question in there. Our current analyses are looked at very individually for a variety of reasons in order to both identify those specific climate impacts. If we look at compounding, that is an area of research we're doing. I know Caitlin's had discussions with various folks at EPA, and there is far larger federal agency interest in looking at it, but it's a very, I would say, challenging one, because then the question is like, well, is that the impact from climate, or is that an impact from another impact from climate? Like you start to, it gets hard to tease out what the effects actually are and which climate stressor is causing it. But we do know for a fact that obviously children that live in, Florida that are dealing with hurricanes could also be dealing with poor air quality. And that's where we narratively tried to discuss and acknowledge those effects. But quantifying that gets, I would say, pretty tricky, and is one of, again, those areas of interest for research, but one we haven't mastered yet.
Mhm.
So hopefully that answers, a couple of the different questions you have.
Thank you.
Lori, did you ask both of your questions? I know you had two that were in there.
I did. The second one was on the compounding and cascading. And so Lauren did a great job. And I was just thinking, just to follow up on your last point, Lauren, that one of the really difficult things too is that those impacts aren't additive, right? That they may be something closer to multiplicative, that with each fresh stressor that children may be suffering, in very serious ways that we're not fully capturing. So I just really appreciate you acknowledging that and trying to bring in the qualitative and the quantitative, where we're at with the data that we have to try to capture those current, but also the future conditions. Thank you.
Great, thank you, Lori. There's another question in here from, I think it's Katie on Converge. And she says, with the changing climate, should there be more emphasis on how regional diseases or regional exposure may be changing for certain areas that may have previously not had those stressors?
That certainly is a completely valid mitigation option that I did not mention in my earlier response. So yeah, absolutely. And that's one of the things that we wanted to highlight with the Lyme analysis in particular. Our branch has actually done some other research on other types of infectious diseases, including West Nile. Oh my gosh, I'm thinking just the scientific name. Valley fever, which is basically a fungal disease. And in the desert Southwest, and that's driven by arid conditions. And so those are kind of more regional in scope. And so increasing awareness of these illnesses, like with Lyme, of these illnesses, of the symptoms of, in areas where Lyme or other illnesses hadn't previously, or types of health effects hadn't previously been common or an endemic. That's a really important mitigation strategy. So yeah.
Great, thank you. And then Atik has a question about compounding impacts, but I think you already covered that. So I'm going to skip that and go to a nice comment from Sylvia, who says, thanks to both of you for this research. Certainly this information will support various efforts regarding the vulnerability of children, as well as parents, grandparents, and others engaged in intergenerational family community support systems across cultural perspectives will be of benefit. And then she asks, will there be opportunity for you to partner with other stakeholders such as UNICEF?
Yeah, so we have been doing that actually. We've been talking to and we'd love to talk to more groups if you know of other organizations and other groups that are interested in learning about this report, or talking about the work that we've done and how our work can help inform their own efforts. We'd be more than happy to. We've talked to March of Dimes a couple of times, Human Rights Watch, a number of other groups that are in organizations outside of the federal government that are focused on children's health, and children at varying age ranges too. So absolutely, we would love to talk more about our work. We love talking about this report. Like Jennifer said before everybody signed on, it's a lot of cute kids, and you want to keep kids safe. So.
And I can just add, in this particular case with UNICEF as an example, of course, we're happy to talk to all the groups, but our analyses do caveat are US based only. We do not do international analyses. So from that perspective, hopefully our report is useful as perhaps a model or something that could be leveraged in their own work, but obviously the impacts in their countries and communities could look quite different. Also, their populations may be different. So there are those sort of caveats, but that's the only reason why UNICEF probably wasn't one of the main ones, simply because as it's international focus, we really were targeting our domestic audience. But likewise, if there is of interest, we're happy to talk with them as well.
Thank you. And then I actually have a question. You mentioned in your closing slides that the report does include action items to reduce the negative impacts of climate change for children. Can you go into those a little bit more now that we have a little time?
I think there's about 8 pages of action items, Jennifer. So, Lauren, I don't want to steal your thunder, but since that was your slide, do you want to talk about that, or I could? Okay.
Yeah. Yeah. So so a little background on it. One of the areas we've been trying to expand on is with our reports and also with EPA's climate change website. We don't want to just discuss, obviously, the negative impacts of climate change. Obviously, those are at the forefront of everyone's mind, but that's very also doom and gloom, which we know can be paralyzing to people or very disheartening. So part of our approach now with the research that we're doing is also to do our best to, I don't want to say temper it, but provide actionable information that people could take, both to engage, but also hopefully, activate people to want to improve things. And that goes from a mitigation and an adaptation perspective. So within that chapter, we do break it out and we do discuss things purely more adaptive actions that individuals or communities can take. Caitlin mentioned with Lyme, for example, proper behaviors around that during high tick season. Preferably don't go out in the middle of the woods where ticks are going to be and, have them climb all over you. If you do go out, like pull up, wear long pants, wear long sleeve shirts, wear good insect repellent, check yourself when you're done, check your kids, things like that. Those are very typical adaptive. For the extreme heat, it would be, being very aware of those high heat days. Don't let children play outside during those peak hours. Preferably keep them either very early morning or late in the evening, kind of a thing. Wear sunblock, all those kinds of things. A lot of it fairly common sense, but again, very doable. Then we have also a mitigation section, which is really trying to get at those emission-oriented behaviors. So, working hard on energy efficient appliances where you can, that's within reason, encouraging communities to have more energy efficient features, your electricity, things like that. And of course, more broadly, we wanted to emphasize encouraging communities as a whole to do things, because obviously individual actions only get you so far, but it's really when you look at it cumulatively and really get the communities as a whole to push for things, that's where the big gains can be made from a mitigation perspective. Because again, there's only kind of so much an individual can do to mitigate their own emissions. It's our cumulative emissions that are the real problem. So we have that broken out as well. So that just gives you kind of a general idea. And for mitigation, obviously, public transportation is preferable to 1 million cars on the road. That helps cut down on the emissions cumulatively, as just an example, or biking or walking in favor of just always hopping in your car if you have those options. Again, caveat there is not everywhere in the US can do that. It really depends. If you're in a rural area, you've got to use a car. So, but maybe you get an energy efficient car and or a fuel efficient car, I should say, like a hybrid. Those are just some of the examples, but within the report, obviously, you can dive much more deeply. And if you're interested more broadly about climate change and what you can do, our website, and I can give you the link, we have all of that information, as well as like what EPA is doing regarding climate change, everything from research to partnership programs, put in that plug, etc.
Great, thank you, Lauren. We do have another question from Zoe, who says, I realize you may maybe address this question about stakeholders already, but I'm curious if your team is coordinating with FEMA on any of these cost estimations to support benefit cost evaluations for local communities to fund climate resilience projects.
Yeah, so I was just starting to respond to that one, and also Megan's question is related. So with these analyses, with this report, we did not coordinate with FEMA, although we have presented to individuals within FEMA. We've also presented to other areas of the US government, including the Department of Education. One thing I wanted to mention is that we're very involved, our branch is very involved with interagency working groups, interagency efforts. So we work a lot with NOAA, the CDC, other parts of Health and Human Services, and, NASA, agencies across the government. And so we've presented to a lot of them, including in a subcommittee that specifically is focused on children's health. In terms of FEMA, we did not coordinate with them specifically on this. I don't know about other analyses that our team may have done. I know there are some areas that where our team has worked with FEMA, for example, on developing different national climate assessments over the years, a report that came out in 2016 that looked at children's health. So I'd be happy to find out more about that if you're interested, and please feel free to send us an email. As far as the Department of Ed, I would say the same thing. We've talked to individuals within that agency. We haven't done a specific Department of Ed presentation. But again, if you're interested in it, we'd be happy to talk more. We also would be happy to to talk more about, I know specifically in terms of heat and learning, that was something that I remember actually getting asked about by individuals in the DOE. So, yeah, anyway. And we have also, same thing, same with HUD. We've talked to a few people in HUD, presented to a few people in HUD.
Great, thank you. All right, we might have time for a couple more questions if anybody has one. I think it says thank you. If you had one item you wanted attendees to take away today, what would that be?
Lauren, you want to go first? Or you want me to go first?
Well, just because I already talked about it ad nauseum, if you are working on those research limitations, I think trying to communicate broadly with different groups who may also be interested in it to better collaborate would be wonderful, because there's so much going on and it is hard to keep track. But yeah, really figuring out how to best leverage the many different work that's going on, that maybe then we could actually crack some of those difficult limitations that exist. So that would probably, I'd say that would be mine as a researcher. Go ahead, Caitlin.
Yeah, I think there are a couple things. First of all, it really takes a village, right? I know it's cliche, but it really truly does take a village to raise kids and to have healthy and happy kids. And so we hope that this report is just some information to help you in your own wheelhouses, to inform you about how to keep your kids and the kids you work with safe, healthy, happy, and living their best lives, literally and figuratively. I think, one of the things that we'd like to convey is that, climate change is happening and it's important to be aware of different effects. So, again, we're more than happy to answer your questions over email. Please send us an email if you have any other questions, if you have any thoughts about, about the work that we've done. Thank you very much for your time.
Thank you both so very much for this incredibly important conversation. It really is such great work, and we're so excited to be able to share this report widely, and we hope that lots of researchers want to pick up where you've left off and carry this on. In addition to offering gratitude to you both and the many other contributors to this outstanding effort, we want to again thank FEMA and the National Science Foundation for making this webinar series possible. We also are grateful to all of you for joining us today. So before we close, just a couple announcements. First, please remember to contact us at hazctr@colorado.edu if you plan to request the continuing education credits generously offered through IAEM. And finally, we hope you will save the date for our next Making Mitigation Work webinar, which is on Tuesday, February 13th, 2024 from 11 to 12 p.m. Mountain Time. We also hope you will subscribe to updates through the Natural Hazards Center website, so you will receive notifications about our upcoming webinars and other free resources and information, including signing up for the Natural Hazards workshop announcements. And on behalf of our entire Natural Hazard Center team here, we want to thank you again, Caitlin and Lauren, for a great presentation, and all of the participants today who joined us. We look forward to seeing you all again in February. Thank you.
Thank you very much.
Thank you.
Bye-bye.